What if, instead of placing the implant here where the tooth is missing, we would need to place the implant on top of a still existing tooth and to design a surgical guide so that we could remove this tooth and replace it with an implant using a surgical guide, both in the same operation. Let's see how we can do this in Panmeca Romexis. So first, we have positioned the implant. Just like always, there are separate tutorials about adding and positioning implants, and then we can continue the surgical guide design like always. Here, we can naturally first fix the insertion direction when needed, and then we would continue like normally, drawing the guide area where the surgical guide would be created. So most of this guide design information is covered in other tutorials, but here let's just focus on this special case where we have this still existing tooth. So normally the software would consider this tooth as a normal tooth that would be still in the mouth of the patient at the time of the surgery, so it couldn't create this sleeve holder here in the place of this tooth. So we'll need to indicate for the software that this is something that it can ignore so that the sleeve holder can be created here instead. Firstly, let's hide this implant for a while so that we can better recognize the tooth below it. So let's use this eye icon next to the implant in the object browser. So now we can firstly orientate the dental model so that we can see the occlusal surface of the tooth to be removed, so that we're basically viewing it from the insertion direction. And now we'll activate this tooth extraction here in the guide design toolbar. Then let's reactivate this draw guide area. And now we can carefully determine the area of the tooth to be removed. So here we need to be very careful that we're not drawing this area on top of the neighboring teeth, because they won't be removed. If we would extend this area of tooth removal also on top of the neighboring teeth, the software could create as a sleeve holder that touches also these neighboring teeth, and thus the guide wouldn't fit. If we manage to draw this area also on top of neighboring teeth, we could activate here this remove, and we could remove the excess area. So like I said, we need to strictly define this only on top of this tooth that will be removed. We don't need to worry about this area covering also the sides of the teeth, so there's no need to fix those. The important thing is that we are strictly on this area of the tooth to be removed. It doesn't also need to be exactly the size of the tooth. It can be a little bit smaller as long as it's not bigger, like said. So now we could set the 3D printer options and sleeve holder parameters like needed. And then before calculating the preview, let's remember to make this implant visible again. And then let's calculate the preview and let's see how our sleeve holder looks like. So now after calculating the preview, we can see that the sleeve holder got created here on top of the still existing tooth. And as we didn't mark also this neighboring tooth here, we see that Romexis took that into account, making space for that. So now we could proceed to modifying the guide and creating the final guide. All of this is instructed in the other tutorials.